noticed that it's one of the questions that parents ask at CP Thursday. Every time someone talks about their child, questions come. Does he or she have seizures? Yeah, you'll expect some follow-up on that. Sometimes there's no real follow-up on that question. But I guess they're asking because they have their own experience with seizures. Seizures can be quite unsettling for the family, for the parents. And even if you have a carer or somebody who volunteers to stay with your child, like you take the child to school, the first time they see the seizures is very scary. But the truth is that it comes in different forms. Some are very silent in the sense that all you see is the child just seems to be in a state of suspended animation, eyes not very, eyelids flickering, and the limbs like shaking, but not the same kind of thing you see with a typical epilepsy where, the whole place goes crazy. But it's still seizure all the same, and it has a negative effect on the brain of a child. So it is always recommended that the child should not be in that situation for long. The simplest cure that I know is to sedate the child so that the child calms down, probably goes to sleep. When Laulu was very young, I'd say maybe before he was like 3 years old, he had seizures regularly, but usually at night. And if the mother was not observant, she wouldn't even know. Okay, and so she got used to sleeping with the lights on and with one eye open and so on and so forth. And we would have to rush him to a hospital, and then he'll end up being heavily sedated and he'll sleep maybe for 24 hours and stay in the hospital for observation and all that for another day or so. Inconveniencing, expensive and so on. But when we were fortunate to go to India on a course and we took him, the first night he had the seizure, we took him to a hospital. And I remember there was this young, maybe 26-year-old girl, young doctor, and she just gave him a small dose of what I'll say is the same injection, because in Nigeria, after the whole room, you'll be smelling the diazepam, and because there was just so much, and that's why he would sleep for so long. And she said we should take him back home, and it's like, excuse me, sometimes you're down to this young doctor. He said, it's supposed to be on admission. It's supposed to be on observation for a while. She said, no, it's okay. You'll wake up in the morning and you'll be fine. And then she asked us whether we didn't know that we should have something at home, which is a suppository, which you can just apply anally. And that's how we got those things, and we have continued to use them. They're a bit expensive, and you cannot buy them off the shelf, meaning that you must get a prescription for a doctor before a pharmacist will sell it to you. But that's what I'm saying. A lot of our doctors don't even know these things. Pediatricians, some of them don't know. So it is when we tell them about these things that some of them will now understand, okay, let's do this so that you can, do this. Now, he still has seizures fairly regularly, but we are so stable now that we can apply the medication, and sometimes if he's eating, within 5 minutes he calms down and he actually goes back to eating, okay, and so on. So seizures, you see, because this is a damage in the brain, and it depends on the part of the brain that's affected. So some children will have a lot of seizures, regular seizures, and some will not. But when they do have them regularly, you need to figure out how you can handle them. In fact, you see, by the time your child is 10 or 12 years old, you should have become an authority on the kind of things that go wrong and be able to manage many of them in the house, at home. Because when you can knock off all this rushing to hospital, you also knock off a lot of expenses. Thank you. Okay, Daya,
Thank you very
to the next
much.
question?
Yes. So we'll go to the next question. It says,
Please, can I come in on that, please?
Okay.
On the seizure thing, please.
You have the floor.
Yeah, as a mother, I would like to suggest that you take your child to the doctor. When your child has had the first seizure, second seizure, the doctor will prescribe what to use. So it is not something that you try to figure out yourself. There are some that are very cheap. They will tell you to calm him down and to reduce the seizure time. So when you get to the doctor, you must go to the hospital. You must see a doctor about seizures, that my child is having seizures, and they will prescribe something for you. It might not be what they prescribe for us there. You might not be able to afford it, but I know that there are some that I buy now for 500 naira. I won't tell you the name because I'm not a doctor. I'm not supposed to prescribe. But take your child to the doctor and lay your complaints. And then you'll be prescribed this thing. Anytime the child has a seizure, you can crush it, give it to the child to drink, and the seizure comes down. Let the seizure finish, and then you give him the medication. And that's it. But don't self-medicate. Don't start looking, and don't say you won't give him anything, because in the course of taking care of Olalu for 25 years, we have learned that if a child with cerebral palsy has a seizure and you don't do anything, you have another seizure after that. You may have another seizure after that. So if a child has a seizure 3 or 4, 6 times, one after the other, then you get panicky. But if for the first time you have given him that medication, then he calms down, then he relaxes. Please go and see a doctor and complain about seizures, so that you know what to do when they happen. Thank you.
Thank you very much for that contribution. So yeah, we go to the next question, which says, despite several prescriptions, why do children with cerebral palsy still have stiffness in their bones? This is from AO, mother to 18-year-old living with CP. I take the question one more time. Despite several prescriptions, why do children with CP still have stiffness in their bones? Sorry, please, could you unmute your...
Okay, sorry. Okay, madam. The nature of your question shows that you still have an issue with cerebral palsy. The stiffness is not in the bones, it's in the muscles. Remember, CP affects the child's ability to control their muscles. And you have two types. You either have a flaccid, which means flappy, uncontrollable movements of the hands or legs or some parts of the body, or you have the stiff part, where when they get angry or frustrated in trying to say something, they stiffen up. And then, because children who have cerebral palsy startle easily, if they're in a wheelchair, the tendency will be to hold the handle of the chair, which is either upwards behind or lower behind them. And they can forget that grip for an hour. So the longer they stay in these positions, the more comfortable the muscles and everything gets used to that. So that becomes like the natural position. And that's why you have all this twisting in the body and the limbs and so on. There's also the fact that CP creates what is like a condition like stroke, in which case one part of the body that is affected becomes weak, and the other part that is not affected takes over by pulling the body to the side where there's strength. It's like having a rubber band in your hand. If you pull both hands equally to the side, you'll have expanded rubber band. And if you release it, they'll both come at the same pace, they'll both come back to the center. But if for some reason there's a stronger pull to one side, what you'll end up is seeing the body shifting to that side. And as they get older, it becomes stiffer and stiffer. And this is why physiotherapy is very important, that instead of a child forgetting to move a particular hand for hours, you encourage them to play as a form of therapy, to grab, even if you say take and they want to bring the good hand, you insist use the other hand. And that forces them to keep using the other hand. And thereby there is, some form of mobility. I don't know if any of you have ever been sick to the extent that you had to stay in bed for about a month. I have on a number of occasions. And what you'll find is that by the time you are back on your feet, you are not even comfortable stepping on the soles of your feet. You're not able to walk. Your joints are stiff, and it takes a lot of physio to get you back into the proper movement. Unfortunately, these children of ours do not have that luxury. And then the medication they are taking is just to help with the relaxation, not to become an alternative to physio and every possible movement that we can do. That you see, you take a normal 4 or 5 year old child in the house, he's running all over the place, he's touching everything. And that's why, when it gets to about 8 p.m., they pass out. They don't go to sleep, they pass out. You can actually carry by the leg to the bed and they won't wake up. But guess what? Anytime between 5 and 6 a.m., they are up again and they are back in action. And they are wondering, Mommy, why are you still sleeping? But they don't know that while they were sleeping, you were working, and so on. So please, at 18, a lot of damage has been done. And usually there could be need for what is called tendon release, because the tendons have become stiff and they have to do a surgery to cut them. And depending on who does it and to what expertise, it may result in their ability to walk better or move their hands better, or it could result in a situation where at least what you get is your ability to at least wear their clothes for them easier and so on. But let me say here, no matter how bad a child's situation is, the important thing is their mind. And when you find a way to engage them and interact with them, you will find that their minds are working, their brain is working, and they're able to somehow find a way to contribute to society. I spoke some time ago, I mentioned at one of my talks from the past about a lady in India who is about 38 and who's been stuck in a wheelchair for most of her life. And because of the advent of technology, she found that she had control over one finger. And she was over maybe 2 years able to type a story, a book, which she calls My Little Finger. You can Google it, I'm sure you'll find it online. Or if not the book, but at least the story of this lady titled My Little Finger. And that's it, just sitting down in her chair, because she has, she can see, her brain is working. I don't know if she is verbal, but she was able on her own to type that book. And it went viral at the time. Thank you. Have the next one.
Thank you.
Mr. D, can I contribute also?
You have the floor.
Please, if your child is 18 years old, like my husband said, it is not the bones, it is the muscles that are stiff. And your child might need what is called muscle relaxant. That is why you have to go to general hospital. You have to see a neurologist, doctor of the brain. You can't get them in all these small hospitals. You have to go to a general hospital. Even if you devote one day, a week, if you have an appointment, as your child is 18, you might not be able to carry the child every time, but at least the first time the doctor might want to see the child. And then they prescribe for you a muscle relaxant. That's number one, to relax the muscles for you. Then physiotherapy, even if it's once a week, you can afford. Also, they have physiotherapy department. When you finish with the doctor once a month, you go to the physiotherapy, you sit down and you let them move the hands and legs for you and show you. And when you get home, you can be doing that. And if you can afford it, then you do the tendon release. We had to do that for Olaolu because all the muscles were stiff. We couldn't wear clothes for him. They had to do it in both legs and in one arm, and we left one hand. So they will just cut it and release the tendon or the stiffness. So it's a bit soft, but with muscle relaxant, with physiotherapy, a child with cerebral palsy needs physiotherapy all their life. You don't do it for 1 week and say that is it. Even you, the father at home, when you come back from work, just move the hand 10 times, up, down, move the legs, gently, gently, gently. Move, that's it. In different ways, you can help your child. And then change their positions. Don't leave your child in one position all day. If your child is on the side for 2-3 hours, change it to the other side for the next 2-3 hours. Then put the child to sit. I saw a child of 7 years old one day being fed. They were carrying him. I said, your child must be able to sit. You can prop him up. You can use pillow. You can use your wrapper, tie him to the chair and let him at least have some form of freedom sitting down, and then you can feed him. So all these things you can find out. Occupational therapy, when you go to general hospital, they are there. They can make the chair for you locally. And then the child can sit down, you can strap him with your wrapper, even if you don't have a wheelchair. So those are the things you can do to help your child, because it will reduce the stiffness. But if you don't do anything, the child will become stiff. There's nothing you can do. It's the muscles that are stiff. It is that part of the brain that controls the muscles that is damaged. So you cannot force the muscles. You have to take muscle relaxant, you have to do physio, and then you have to do some things by yourself and moving so that the child doesn't have bed sores or then become stiff on the floor. Thank you, everybody.
Thank you for your contribution. We still have some questions in the chat, but I would like to ask if anyone wants to ask their question live, so that we could just get a bit more interaction. Okay, I see Uche. I'm going to ask you to unmute so you can ask your question. Thank you.
My own is not really a question. I want to say what Daddy said. What we're telling our story, we should also tell it to our villagers, our friends, and because I remember when I was young, my mommy actually told me, she told me the whole story. That why I can do advocacy well. If you need to tell them to feel sorry. Thank you.
Thank you, Uche. Is there anyone else? Just identify by raising your hand. But before we do, maybe let me just take the last question that we can because of time for the written ones. Then we can take one more in person. So this one says, is there any law in place that can act as a penalty or punishment for a doctor's negligence? I'm guessing it has to do with if they are negligent with your CP child. Is there any law in place that can act as a penalty or punishment for a doctor's negligence? AVM, over to you.
I know that in the United States of America, and you see it online, there are many doctors many lawyers who even have websites where they tell you if your child has CP, you should contact them because they want to ask you some questions. And from there, maybe a case can be made against either the doctor or the hospital where you had the child for negligence. I guess that works in the US because, they have this, they've always had the possibility of suing everybody. If somebody invites you to their house to come and have dinner, and you have the dinner, you enjoy yourself, maybe you even overfeed yourself, you go home and you have running stomach, you can actually sue the person for making you sick and so on. So malpractice, it's a malpractice law, they call it. Some people have actually turned it into a kind of business where, the lawyer that helps you, of course, get a sizable percentage of the money. But you see, we're in Nigeria, and we must understand that some things are not so easy. There is a joke that has been going on like forever that says doctors' mistakes are buried. All you get is sorry and whatever and so on. In fact, some private hospitals in Nigeria or clinics have perfected the art of keeping your patient or their patient until the stage when they become very disturbed. I was in Makurdi, I need to mention this, for some years, for some period. And what you hear on Radio Benue all the time is somebody just died at the Federal Medical Center. Somebody just died at Federal. It's like everybody dies at the Federal Medical Center. And at some stage, I had to raise the observation to some medical person in government. And he said, the simple truth is this. By the time the doctors in the clinics see that the case is becoming, in fact, sometimes they keep the patient for too long, thinking they can manage it. But once they realize it is becoming terminal, then they refer you to, the Federal Medical Center, or like, I'm sure if you talk to people in Luth, they'll tell you the same thing. Because to take your patient to Luth, you have to first settle your bill with them. And then once you are out of their place and you go to Luth, whatever happens, they don't have a responsibility anymore. So there are issues we have to think about. But again, if you're going to talk about practice, it must be maybe within the period when the child was born. You can't be talking about practice 5-10 years after the child had left the hospital. So I prefer to tell people that, look, let's focus on the reality now and figure out what we can do. We need help. We need government. We need private sector, particularly on the side of government, to figure out. As somebody who commanded units that had hospitals, I know that for years, especially during the peak of HIV. In the military hospitals, we had free clinics for HIV, and those people who had been tested positive and all actually came maybe weekly or so to receive free medication, retroactive drugs for their HIV. And so it is the kind of thing that Benola has been pushing from day one, that if government gets to recognize this situation as being challenging for parents, then government and big organizations should be able to consider bringing in the medications so that they can be dispensed either free or at some highly subsidized rate. I hope you all know that the Nigerian law says that every child under 5 is entitled to free medical care. But unfortunately, there's hardly any hospital or clinic that you'll go to that will respond to you, because we make laws, but we do not factor in the requirements for that law to work. For it to work, there must be a place where the doctor, after treating 20, 30 children with CP, will be able to report to in the Federal Ministry of Health and be reimbursed. That doesn't exist, even as of today. So the law is there, but we are not, so these are some of the things that as parents, we should be thinking of coming together on World CP Day, on so and so days, to champion, to discuss beforehand, and to see how we champion those causes. It's difficult alone to continue to just talk about it. I know one gentleman, some of you may know him on Facebook. His daughter is about 14 years old now. He's been pushing a movement. Every time he'll post something and tag about 90 people, including myself. And he's been pushing to sue Lagos State government for his child's cerebral palsy. And I'm not sure he has made any progress up to now, for so many years, because that seems to be his main focus. But honestly speaking, the issue is not about suing a doctor. It's about getting the right kind of compensation and treatment opportunities for our children. Thank you.
Thank you very much. And the last question is a simple one and really straightforward. It says, are orthopedic casts and splints made for children suffering with CP? Are orthopedic casts and splints made for children suffering with CP?
Okay, again, I see a problem with the question. I don't like it when people say children suffering, because the children are not suffering. They're living with a peculiar condition. And, when we take that suffering out of our mind, I think it begins to make our understanding of the situation easier. So terminologies, we must, as people who have children living with these conditions, we are the first set of people who should be using the right terminologies to refer to them, especially when we're talking in public. Now, when it comes to casts and splints, I see a lot of children with casts. I even see videos, some people post videos of how their children are being put in a cast. Those of you who can go to our website and look at the presentation about cerebral palsy. We have one on the many phases of cerebral palsy. It's a very brilliant lecture. All of our lectures are there. If you look in the in the resources section of our website. And so you can open them, you can read them, or you can even download them for further study. What it tells you is that no two children with CP are alike. The way they are affected differs. And so you cannot look at somebody's child and say, okay, I also want to do this for my child. And I've had a few interactions with some of our people, physiotherapists, and authorities, these people who make splints and stuff for the children. Many of them are used to were trained to deal with adults. And you see, when an adult has a fracture, it is clear. You set the fracture, you put it in a splint to immobilize it for a certain period, maybe 6 weeks or 2 months, so that the bones can set. And then when you take it off, the person can probably start to walk again normally. But when you're talking of a child with cerebral palsy, and it's very important between that very early age up to like about 12 years old, the twisting of the body continues. It's a progressive deterioration. So trying to stop it by artificial means can actually injure the child and create more problems for that child. And I tell people, when your child is doing physiotherapy and the child is crying, you need to intervene. That, somebody is over bending, over stretching, whatever it is, because the person does not even understand how the muscles and by implication, the bones have been affected. There's a lot of people who are thinking of correcting. You cannot correct. And that's why those of you who are observant will find that some of our adults living with cerebral palsy, they walk funny. And I've had cause to kind of convince a couple of them to come out and tell people that, yes, I did not walk up till about when I was 12 years old. And then the magic or what miracle that happened is that I had surgery to remove certain stiffnesses in certain areas and so on. And those are the ones that even when they're walking, you'll see that it's almost as if they're bent. Their knees are bent even as they walk, because if they over-straighten it, they may not be able to control the muscles on the legs again. So these are experts working. But when you're dealing with people who just think that they can treat it like this, then you get this, what will I call it? You'll get, they'll put it in plaster of Paris, POP. Like I said, if the situation is not too bad, you will see that the child is actually walking. But honestly, we have to make sure that we're getting the right experts to help us to do what we're doing. Thank you.
Thank you. Well, we still have a good 10 minutes. So before we take the closing remarks and vote of thanks, there's one hand. So I would just make this the last question from Emmy Johnson. If you could hear me, I've asked you to unmute. Please unmute.
Okay. Yeah, I've unmuted myself. Good afternoon. Yeah, good afternoon, everybody. Good afternoon, Daddy, and everybody in the house. It's a great privilege to be in this meeting. There are some other days that I will even forget. Today I had to put a reminder. So please, there are things that bothers me. Because, personally, I will not want other parents or mothers to go through. It's emotionally draining to have a child with cerebral palsy, especially if you are the only one thinking as a mother, or maybe a father is vice versa, the only one thinking of what to do to bring this child or to make this child to be up and doing in case you are no more in this life. So when it's one person, one is sided, one person, so it's very emotional and it's emotionally draining. And my question is there any way, I don't know, even to create awareness, because there must have been something that happened before, apart from the doctor's negligence. Sometimes you listen to stories, the nurse was sitting on their tummy, they are forcing the child out, and the end of it, the child these things. Some of them go through all these things. So there are people that have not gone through that. They just got pregnant, do all what you're supposed to do. I don't know, along the line, maybe there's something that caused this thing. So is there any way that we can, I don't know how to, so that other parents will not bring these children to this world to go through this? Really, it's emotionally draining. If there's a way we can maybe create awareness, or maybe medically there's anything parents can do so that such children, not that they are really, I don't know how to put it, so that will not bring, these children will not come and be like this. If there's anything, if there are defects, is there anything that parents fail to do, or anything so that this thing will stop? That's my question, please.
Okay. I would say that we need to be very careful about what we say concerning special conditions. Nobody prays to come to this world with a defect. And a lot of times, the parents did not do anything to end up with a child with a defect. From my understanding of scripture, I know that sometimes God deliberately sets out to test us by giving us special children to see how we will rise up to the challenge. And like every difficulty in our lives, the earlier we accept it and begin to move with it, the less it looks like a problem. Then we need to understand that there is no known specific cause of having these children. The complications that happen at birth, which most people talk about, a doctor's negligence, it is on record that it's only about 15% of the children with CP. So we're talking about a possible 85% that are because of the mismanagement of the pregnancy by the, let me say the mother. And then, of course, there are those ones that happen after birth in the 3, 4, maybe up to 5 years. Some children are quite okay for the first 2 or 3 years. And then they end up with malaria, meningitis, and so on, that is misdiagnosed. So in the process of misdiagnosis, the wrong treatment is applied and it affects their brain. So what do you do about that? You also have the situation, like I said, when the mother is pregnant, she continues to have an active social life. She's smoking, she's drinking, she's not going to antenatal regularly. These problems occur. When you have a child and you have some complications, you go to your neighborhood doctor who doesn't even understand these things. And all he's concerned about is doing tests and tests and tests. And at the time when he should have said, Madam, take this child to either a Federal Medical Center, General Hospital, or even a teaching hospital, they're still trying, because with each test, who pays? You. So we need to understand, Madam, that if it was possible not to have these children, the developed world, Europe, America, Canada, Australia, and so on, even Japan and China, where they have state-of-the-art medicine and medical practices and so on, would not be having these children, but they do have them. And in really reasonably large numbers. The only thing is that the system has perfected care and management to the extent that the parents have little or no stress where this is concerned. And so that's what we should be thinking here. How do we get ourselves, first of all, to understand, and how do we get other people to understand? How do we get young mothers or whatever who are very active socially to understand that, hey, you need to slow down. You're pregnant now, you need to change your lifestyle. it can only come from experience, and it can only come from those of us who are experienced, are out there speaking and doing everything we can to get the world to understand. And that's why I told you at the beginning that after a couple of years, I got tired of going to TV stations or radio stations just to describe what cerebral palsy is. And I started to explain that, look, we must take it to the next level, because every year I am learning. Even from this Hangout, I've learned a few things again, okay? From what parents are going through, what inadequate knowledge is creating. Now, if a parent doesn't quite understand the situation and they have to go, or somebody asks them anywhere about what's the situation of your problem. I mean, there are people who, or how can I help you? Some people, all they want is, I want a home where you can just go and put this child, let me get on with my life. I hope you understand me, madam. So even you, I would like to say, please take a little more time to understand cerebral palsy, what causes it, and how can we move on with my child. All these adults that you're seeing that they're doing well, they're married, they have children, they're driving a car. Hey, shout out to Uche who is here. Do you know that Uche will be celebrating 20 years as a teaching staff at Open Doors in Jos this November? That is 20 years that she has been working and even earning salary. Uche, I'll be alive. Do you understand? And that's what we're talking about, that your child can still be a blessing to your family. Even if the child doesn't leave the house. If it's not for Olaoluwa, myself, my wife, my son Dayo, and Rotimi, who is here, hey, we'll be doing something else on a Saturday. Okay? So yes, some of you now know me, some of you now know us, some of you are saying very nice things about us and so on. It is because of this young man who doesn't leave the house, who is not even able to attend this program with us. Okay? So please begin to look at your child differently. Stop seeing them as a problem, a liability, and begin to see them as a gift from God. And if you don't yet know, every day when you pray, ask God to show you what He wants you to do with and through this child. The answer will come and you will begin to smile. Thank you.
Thank you very much, sir. Time is well spent, but Mrs. Gbadebo wants to chip in to that question, so she will just chip in and give us a vote of thanks before we end. So, Mrs. Gbadebo, over to you.
Okay. Good afternoon, everyone again. And Emmy Johnson, I really empathize with you because I'm a woman too, and I know a lot of people will be asking questions. You want to know what causes cerebral palsy? There are different reasons. Let me tell you my own story. What caused my son's cerebral palsy was that my stomach was very big. I had a lot of fluid in the stomach, and it was rolling around. It turned the umbilical cord around his neck many times. So he was going to get choked in the stomach. So they had to bring him out by cesarean section that very day because it was all tied around his neck. Of course, when he came out, he wasn't breathing. They had to do everything. He didn't cry for the next 30 minutes. So that was why the brain damage started. If your child, that's why when you have a baby, the first thing the nurses do is what? They smack the baby's bum bum. Say, the baby will cry. And then oxygen will go into the brain. It is that oxygen that prevents brain damage. So when you have a child that does not cry, and most children with cerebral palsy come as premature babies. And when a baby is premature, maybe 2 months before the time of birth, or 6 weeks, of course, it will be put in an incubator. And if your child is not put in an incubator, then the brain damage happens. between the ages of 1 to 5, the child can fall down from the nanny and you will not know. The child will hit his head on the floor. They will pick the child up. Of course, the damage has been done. The head has hit the floor. And it will also be caused by jaundice. Like my husband also said, a woman is pregnant, she's drinking, she's smoking, she's doing everything. That is part of the problem. So there are many causes. There are a lot of things joined together. Even if you don't do anything, like me, if you go, I go for antenatal, I went for it regularly, I don't do anything. The doctor said I didn't do, and I was lucky that it was my last child. So it's not as if I wasn't experienced. But the medical condition with me, my stomach was so big, there was a lot of fluid, and it was floating around, tying the cord around his neck many times. So things happen. A lot of things happen to these children, and most of them are premature. So when you have a premature child, you must have a good hospital that will help you take care of the child. And I remember Alalu, even in the incubator, he had seizures. That was when I knew I had problems. They had to look for vein in his brain, a 2-day-old child. Vein in the brain, because they couldn't find any in the hands, and it was in the incubator. So there are a lot of reasons. Just what I will advise is, accept your situation, do the best that you can. If the man wants to live, let him live. There are a lot of problems in the world. Some people don't have children with cerebral palsy. Some people have children with madness. Some people have children with Down syndrome. They cannot talk. Also, they can walk. Some with autism, and there are different degrees. Some autistic children beat their parents very well. They beat. So, accept what you have. And then, like my husband said, pray. And tell your story. Talk to people. Don't hide the child at home. Where can I get help? What can I do? Like we're doing now. We're interacting. And you feel better when you get home. It's not only you. Everybody here has a child with cerebral palsy, except 1 or 2 or 3. And Uche is 44 or 40-something or 40. So she has survived. She's living with it. She can't walk well. But she's enjoying her life. She's teaching. She has been teaching for 20 years. Usola has a master's degree. She has a job now. We know some adults, they are not working well. They cannot write. Some cannot write with their hands. But their parents didn't give up on them. Do whatever you can for your child. Ask questions. Take him to hospitals. Not people that will be praying. I pray too. I'm a Christian. But don't go to charlatans that you'll be giving money to. Take him to the good hospital. And then from there, you take it one day at a time. Rome was not built in a day. You don't know what that child will become. So please, just learn, go on our website. You see the many reasons why cerebral palsy occurs in a child. And then you know better. So I want to use this opportunity to thank everybody for coming on this platform today. And I want to encourage you that we should continue as parents to join hands together. You see, abroad, all these children are also there. It's not peculiar to Nigeria. But abroad, they have homes for them. If you want to keep your child, the government will help you. Here, the government doesn't help anybody. But abroad, there are homes where they keep them. I don't like that. I kept my child because I cannot do without my son. I don't want to throw him to somebody else to look after him so that you will not be enjoying. And then in those homes, they abuse them. They just give them something and just let them be sleeping like mumus. So keep your child with you. Do the best. It's not only in Nigeria. Americans, you have a lot of children born with cerebral palsy. There are plenty there. I've been there. London, in England, there are many homes for children with cerebral palsy. Everywhere in the world. So it's not only in Nigeria. So don't be complaining that it's only the evil and all these things in the world can never stop until we all die and get to heaven. The devil is around trying to make people suffer. But if you now accept your fate and say, I'm not going to let this thing weigh me down. We came out. That's why you can come to this platform today and say, these people are organizing this thing. Let me listen. because you are parents. So let us do the best and let us cooperate. It is the cooperation of the parents that will make the government to start doing some things. But if we keep quiet, you keep quiet in your corner, I keep quiet in my corner, then nobody will do anything for you. But in Nigeria, if 100,000 parents should come together and start shouting, we have children with cerebral palsy, what is government going to do for us? But if you let only one person be talking all the time, you understand? That's why we are doing this, so that we can enlighten ourselves. We get to a stage that we will now cooperate, to now become a body to be reckoned with, and then we'll be recognized. But if we don't help our children, nobody will help our children. So don't sit in your home and say, I'm going to look only after my child. We have to come together. That's why Benola was founded. We founded it so that we can bring parents together, because we know there are lots of people hiding their children, hiding. Why are you hiding your child? He has ever passed, so what? Some people are dealing with madness. Some people are dealing with so many things in their homes. So don't hide your child. Cerebral palsy is not contagious. You can't catch it. It is not hereditary. It's not that when you have it, your son will have it. No. So cerebral palsy is a different thing entirely. Just something that happens. Some stupid thing that happens at birth that caused. You see some people. You see that it was just by the grace of God that they escaped it. You that you are a parent, you will know. You see the child walking, but with cross eye, with so many signs, but the child is managing. So don't complain and don't think I'm suffering, or it's only me. I know we're all human beings. It will come at a stage, but after that, just shake your body and say, Lord, help me. What do you want me to do about this child? Where can I take my child? If you cannot afford anything, you can go to general hospital. The consultants are all there. You just need to be patient for them to call you in. And when they call you in, tell the doctor this, whatever they prescribe for you, start using for the child, the one you can afford. But don't say, I don't have this, so I will leave my child. So I want to thank everybody for coming for this hangout with the boss today. We pray that God will continue to help all of us to do the best that we can as parents for our children. It is not easy. And let me tell you, nothing is easy in this world. Nothing. All of us know, because we're adults. Nothing is easy. You just make up your mind to do what you know is right, and you never give up. Once you never give up, there's always tomorrow. Thank you so much for coming. God bless you all.
Thank you so much. Thank you so much. Nicely said. Before we end this, I know our time is fast spent. Before I pass the mic to AVM, since we are meeting virtually, we always do this at the end of our programs. If you could please put on your cameras for 30 seconds, let's just take a group picture so that we just mark attendance, and also for record purposes that we were all here today. So just a quick 30 seconds, if you could just put on your videos so that we just take a picture of everyone who attended. Thank you so much. I can see everyone is doing as asked. Thank you so much. God bless you all. Let me quickly take the picture and pass the mic. Thank you so much. AVM, the floor is yours.
Some of you must have seen me laughing. I appreciate everyone. I just saw my sister, Alaji Mokotoju of Yaniura. She took off her glasses and started fixing her hair since picture was going to be taken. So good to see all of you. Thank you much. It's people like her who have a special heart for children. In fact, in the last 2 years, she's done so much for children with cerebral palsy. So we thank you, madam. I want to also recognize here I call him Alaji or Dr. Saad Tajuddin. He's one of the first set of 30 experts that sat with Benola in April 2013 and worked with us continuously for over a year to develop Benola's roadmap for cerebral palsy in Nigeria. A document which we took extensively all over government, and it's still there. We still believe there's a lot of work that can be done with it. And he saw it on Facebook. He's currently doing sabbatical in Gambia. And he said he would join, and he's been here throughout with us. Thank you so much, Saad.
Thank you very much, AVM. Thank you very much.
Thank you.
Thank you very much. Please, yes, I'm very pleased for being here. Thank you very much. And I believe with your initiative, God will continue to strengthen you and the entire family. Thank you very much.
Thank you, Dr. Saad. Okay, and yes, everybody who's out here, I see you, and even those who have not put on their screen. And then for those of you who also left a comment, like on the word, like Mrs. Emmy Johnson, I've seen the comments. I appreciate you too. And I pray that we go back and continue to think about how we can tell our stories, how we can share our stories, and how the stories can strengthen us. There's a healing power. Every Thursday, what I notice is that the parents who is telling their story, they really appreciate the feedback from those who are saying one thing or the other. And the rest of the parents always unanimously say, you're a great mother or you're a great father, and so on. And we should take it even further and try to strike up some friendships behind the scene and see how we can also work on these things. When we, I know we have said some things about the family WhatsApp group, and you know, the thing is that we're trying to maintain some kind of decorum, and so that people don't just share whatever they like, and so that we try to stick to our story. I told somebody during the week that I like to stay on my lane. I think we should also learn to stay on our lane. No matter how passionate you are about some other disability, if you are not talking about the disability that concerns your own household, I think you're wasting your potential. Yes, you can visit other places, you can listen to other places. You see, because what affects parents is virtually the same. The psychological aspects, the mental aspects, and so on, is virtually the same. And so we'll learn more on how to manage ourselves and do things better. So let's move on to enjoy the rest of our weekend, and then